Hey, Dan family, it's Den Mother Amanda. It's good to be here and hopefully see some of you coming in while I'm on. If not, that's okay too. Hopefully, you watch it. It's another rough topic again about trans children and medical transition of children. Um, and I'm gonna try to look at the facts on like three different sides: the medical side, the parents' side, and the child's side, and try to get some honesty about all of those, and hopefully it brings people into a civilized discussion to where a lot of us can actually get together on all sides and come with truth and facts and compassion and empathy for our children as it pertains to medically transitioning and what the truths and the facts are about it. That topic. Guess I'll try to start with the children, and I'll go a little bit on my back experience in the course of this conversation as a child also. Help emphasize some things that I believe are true for all children, in all walks of life. And sometimes growing up is not easy for children in today's world with all this technology and everything going at high speed all the time. And feeling like children feeling like if they're not going fast enough or doing enough, they won't keep up or they won't feel like they're enough. And they are enough. They are worthwhile. They have value, and they have children are important. They are our future. They're the ones that are going to be taking care of us when we can't do it for ourselves. And they need all the love, acceptance, and tolerance that they deserve because they're innocent. And the kids make mistakes. Yeah, absolutely, we do. I made mistakes as a child too. It's part of growing and knowing, getting to know who I was, and having ideas about the type of person I was when I was a child. Some of it I know what it is now, things were, and having now looking back at it, and I didn't know back then what it was. I was struggling with my identity as a child, and hoping and wishing that I would have been born with a female, and hoping beyond hope that maybe one night I would go to sleep and this mystical God would turn me into a girl like I should be. And that never happened. And I remember a couple of times just having dreams, and then growing up as a teenager, started going through puberty, just, oh, wow. Add in on the extra confusion, and what's going on, physically, mentally, and emotionally. Ups and downs, and there was stability in there on my behalf as well. There was stability. There was some stability there. And I grew up in a time without smartphones, laptops, computers, or any of that such thing. And all the phone we had at home was the one on the wall or on the stand, and I had a cord to it. It was either push button or rotary on dial. I grew up at a time where it was mostly rotary, turning into a push button, and then that counted. They had both versions. So yeah, I get an idea of what it was like then. I grew out in a farming town, and what was nice with that is in having to use my imagination for things. Find ways to have fun, distractions, things that would hopefully help me grow and in those uncertain times feel better about myself. And I'm wishing that I would have been born a girl so I could grow into a woman. And it it didn't happen. And it was such a struggle at times. And a lot of things came in that weren't great for me in my life that I participated in, and to find some kind of ease and comfort in my life, and for a little while there was, and now I know it's like a gender identity disorder. Now more for a lot of people refer to it as gender dysphoria, and both were true for me. And I believe it is a disorder and a mental illness to some degree because a lot of times it brings in a whole bunch of depression and sometimes a lot of anxiety. And not knowing how to talk to people about that and adults that could help me to get through that discomfort that I had. Um, yeah, maybe I think we all, to some degree, have moments, especially as children. It's what are we doing? What's here? What's our purpose? What kind of person am I supposed to be? Is this the person I'm supposed to be and live as? I grew up most of my life is male and male presenting, and I'm biologically male. I always will be. Um, so we didn't have access to a lot of things that are here and accessible to today for young children, and such as mental health and a lot of extra medical care that has developed since I was a child and a teenager. I'm 54 now, heading for 55, and it seems like every year it goes quicker. Wow, like I said, found out it was gender identity disorder and gender dysphoria, and on extreme discomfort with my mind and my body, my mind, brain to my body, and vice versa. Yeah, just that incongruence. And what I could do about it that helped a bit is explore my gender. And okay, what's it gonna look like with like neutral clothing, so to speak? Kind of back then is like the androgynous look, and I think that androgynous look is probably turned into something a little different today. Well, it's a whole lot different actually. Because being called non-binary. I know. I believe androgynous is the better word with the better definition for that type of lifestyle because it's not a gender. It's just someone that's not conforming to either gender. And I know people were going to say, well, it's exactly what non-binary means. It also means a whole lot. It means a whole something added extra to that as well. And it means that the person has no gender, neutral. And that's just not true. Um, we have a physical sex and a to some degree, even though it is very it can be very minor, based on the biological sex you were born with. This for more than 97% of the population. When people are born male, okay, they've got those inherent genetic traits that, based on biology, take on and show a male and masculine gender. And yeah, there are some things about gender that are socially constructed, as like what kind of clothes, what color of clothes, what colors we like, and how we dress, and what children play with as toys, and what grown-ups um, do, and have, and all those extra things. Um, Outside of what most of the population, that built-in gender to your DNA, to DNA, and there are people and born with gender is different, and that also is true. Although that's not most of the people around the world. Wow, yeah. And some of it helps form what the type of person we're going to be, the things we want to do, our beliefs, our values, and stuff like that. And how we relate ourselves to the world and the world to us. And being a transgender woman who's still biologically male, there are still some biological male gender traits that I still do have. And I don't think all of them are going to go away. And I think it's a lot of the gender characteristics and traits that are inborn, have, I said, they haven't gone away. Those male ones haven't gone away, but there has been a shift in the way I present in physical, mental, and emotional gender. I believe I was also born with, and wanting to be more feminine. And I enjoy it. Being able to look and present like a girl, do things that girls and women do, and participate in a lifestyle that I've always wanted to participate in. And I still do some of those masculine things too. I think if my arthritis wasn't as bad and other things I got physically going on with the physical health, like fibromyalgia and neuropathy, and I probably still mix it in with guys that are playing football. I know now. I've seen guys and girls play together, football together. Okay, but it's not on a school team or college teams or other sports. Where without right at the moment, without lack of a better word, segregated for safety. Some of these sports, segregated between the sexes and genders for safety reasons, and it's usually it's safety reasons more for girls and women. And it doesn't mean it's a sexual safety issue where sometimes it could be, depending on the adults and other people who are actively participating. It could be, but that's not what I'm trying to talk about right now. What I'm getting at is the physical attributes between male and female, and whether you transition or don't transition. Okay. And a lot of times, if girls are playing football with us, it'd be flag football, or two-hand touch football, stuff like that. So where safety, where we were concerned about safety as much, if not a little bit more. And yeah, I believe it's a little bit more for the girls so they wouldn't get hurt. Because they're not as strong, even if it's pre-puberty, during puberty, or after. And those things they need to be considered, even as adults. And biological males, they don't transition, and yet adult females that don't transition. And testosterone is so actively aggressive when it comes to contact sports, and it's easy for males to sometimes overdo it, because we can tend to get into the heat of the moment, and we want to accomplish our goals in those things. And females can get hurt rather easily, and that's what we don't want to have happen. Don't want them to get hurt. Even in today's times, even if it's a biological woman transitioning into a trans man. Yeah, they get the added muscle, the strength and endurance and stuff like that, but it's still not the same as a biological male that's gone through that, lived the entire life as a male. It's just a historical and biological fact. I know, and even as a trans woman, even if I was in my 20s, with the reduced muscle, the reduced strength, and reduced endurance, I still have more strength, endurance, and power, and the aggressive nature in those sports than women do. And I'm not saying women and few girls don't have that. I'm not saying that at all. There's a lot they do. There really are. Um, I got so much respect for girls and women, and a lot of that still too comes down to there's things that people that are born female, born girls and women that can do us men can't do. And that's bear and birth children, and that is so amazing. It really is. And it's beautiful to watch that process. And I know women, it's just a lot of it's uncomfortable. So I've watched them go through it. I haven't gone through it. I know I never will. Even if they were able to get uterine transplants for trans women, I'm a little. I've got kids and one grandchild anyway. I think I'm past the point where I want to have children to raise, and I'm looking forward to more grandkids. And the thing is, there's so much strength in females, girls, and women because of that. Men just don't understand how strong that woman has to be for childbirth. Really. It's one of the closest times that women come to death is during childbirth. Because the pain, the blood loss, the fluid loss, there's a lot of things that happen during childbirth that I know happen because I've witnessed it in person in the room while my children are being born. And watching their mother, carry the child, and for me, it's very sickening and disgusting to say that there's no difference between trans women and women. I really do. Because it's not the truth. And there's things that men can do that females, girls, and women can't do. It's because it's the nature of biology. And there's really no getting around it. Science and medical stuff has advanced quite a lot. I know right now there's things they still can't do. Maybe they'll be able to do in the future. I don't know. One thing I do know is I want to get back on the kids for a minute, trans kids, and I was seeing so many detransitioners, coming out. And I was seeing, just horrible outcomes for some of these young people. And they have puberty blockers and go through some of the other medical procedures for training to be medically and surgically transitioning. Um, and then I find out they're not really trans and start to detransition. And every one of them that I've heard and I've actually watched, say that there is some type of permanent damage that is irreversible, and it's just not going to come back. It's stated that it's not a pause on puberty; it's a permanent stop at certain positions when you're biologically supposed to get there, and whether it be male or female puberty, you miss that section, it doesn't come back. Doesn't come back. And look at case in point, Jazz Jennings, and oh my lord, that poor girl. She's a wreck, and when it comes out, she's really a sweet, loving person. And it's just so disheartening to see her go through the struggles she's going through, because I care about people's well being. And her pain affects me. It makes me sad for her. I get sad for her. And I don't think it was originally meant for this to happen for her. Okay. Because even though science and medical science has advanced so much, there's things that you still don't know. They're still learning. And there's no such thing as a perfect science to the medical field. Case in point, I'm going to bring up something that happened with me in the past, and it has nothing to do with being trans. Okay, I damaged my knee a few times, my left knee a few times. Okay, and I went to the orthopedic and got a bone scan, X-rays, and all these other things, to see what was wrong with my knee. And there were overstretched ligaments and tendons, and there were bone spurs on the inside of the knee. And the doctor I went to, he was so wonderful. He was great. He really was great. He says, and this was, God, 21 or 22 years ago. Medical science had come a long way at that time, and it really had. He says, as good as we are, and we're good, and we're not able to fix things to bring them back to the way they were when you were born. Okay, and we're good with this, and what I'm going to do for you, it'll help you get better, and it did. It helped me get better. And he was right. It wasn't like it was before I injured it. I'll tell you what, it was a whole lot better than what it was. Because there were times I put weight on my knee, and it's like, oh, so much pain. And on, and I had it replaced in December 2019 because there was absolutely no cartilage there between the joint. Um, that was a rough recovery, and it helped make it better. It's not like it was if I didn't have it. It's not the same as before it was injured, but it has made it better, and it has. And, and for mental health therapy, I don't necessarily believe in just affirming a child or an adult's gender identity by saying, okay, yep, I agree with you, you're trans, or you're feeling this, and that, and you're doing this, and that, and you must be trans. It doesn't always mean that. 1 plus 1 doesn't always equal 2. It's nuanced, especially with children, pre-puberty and during puberty. We all know this. There's a lot of confusion, a lot of things that are going on in our mind because our minds and bodies are growing and developing and changing in ways that are, oh my good Lord, what is this about? Wow. It's difficult, very difficult sometimes to navigate and get through. There's where we need the compassion to ask questions to the child. Okay, say something kind of abuse happened, and it still bothers them. Ask questions around that. What was it? What happened? What was it like when it was happening? What was it like after it happened? What was it like before it happened? What were you feeling before, during, and after? Some of those things we need to get right with each one. Each one of us needs to get right with things like that if it's happened in our lives. We need to get right with that stuff. And we can't do that by saying, oh, yeah, you're transgender, you're going to write you some stuff so you can medically transition. In the beginning, that is not the answer. That is not the starting answer. It seems to be the first and only answer that's coming up with therapists. And saying, and some therapists, a lot of therapists saying, if you don't do this, and I've heard it from children and adults, children who have transitioned. Do you want a trans child or a dead child? And what do you think is going to do? That's going to do to a parent. What would it do for you if you were a parent and was told that? And it's not always true. Most of it is not true. Most. I'm saying like 80% or more. And it's probably more than 95% aren't like that until they start hearing it from the medical field. And then after starting puberty blockers, it goes up over 1,000%, 1,000-fold. And it goes from maybe thinking about it, not wanting to do it, maybe thinking about it, to holy crap, I don't want to live anymore. I know what it's like to be on both sides of that, and I never had hormone blockers. That wasn't a thing to give to people or kids back then, except for maybe pausing prepubescent puberty and early onset of puberty for a very, very extremely short time. And then take them off of it so that their puberty can start where it should. The only way that it doesn't completely, totally destroy puberty as if it's an extreme short period. 100% have said, okay, I'm started this. I'll never be able to have any of my biological kids ever. There's one that's kind of not sure, but leaning more than likely, maybe not. And I'm hoping she can do that. I'm praying that she can do that, have her own children, bear and give birth to her own children. Because she was on hormone blockers and then switched to testosterone. This poor girl was put on hormone blockers at 13 after going through 5 years worth of puberty, and she started going through menopause symptoms. This is insane. And I was just watching a video, a YouTube video where she was talking about it, like, wow, hot flashes, tingling pain and numbness in the extremities. Because of going through menopause way too early. Way too early. I know, and going through menopause, we all know what happens when somebody completely goes through menopause. You know what happens? Inability to get pregnant, bear children, and give birth. I don't think she completed going through menopause, but she's had those symptoms. That poor girl. None idiots want to say that they don't surgically transition children. That's a lie. That's an outright lie. And y'all know it. The person I'm talking about had a double mastectomy at the age of 13. 13 years old, a gender confirming surgery. Are you effing out of your mind? She wants to have and bear her own children and give birth. I hope she can. She'll never be able to breastfeed, ever. They don't come back. Breasts don't come back when they're removed. That capability is gone for this girl. The girl is Chloe Cole. She is so sweet. Wow. I give her props for standing up against the medicalization of the children. I know the transgender medicalization of children. Here's what I think it's become when it comes to medicalization of children. I believe it's become an absolute pure evil and satanic empire. And all they care about is the money. Especially the pharmacies, when they know over 99% of these people, whether they complete it or don't, are going to be on some form of medication for the rest of their lives. And you can't tell me that's not about money. That is totally about money. Ass junkies need to get that out of your head and put it into your head that it's about the money. It's not about the child. It's delusional BS is garbage. What's coming out of these activists, and most of them that say they're trans are not trans. Queer is not trans. Gender nonconforming is not trans. Non-binary is not trans. For anyone to be transgender / transsexual by absolute definition has to believe in the binary. This she, they, she, them, he, they, he, them. That's not trans. It's not. I believe when it comes to that, it's a multiple personality disorder. Okay, and I think I've had it. May have even had parts of my life that suffered to us, even if it was a small degree of that too. Okay, because I chose to live certain ways that I wouldn't normally have lived before. And on what I'm doing now when it comes to transition, it's a permanent change. I'm not going back and forth with it like certain things I used to. Okay, being trans is not a back and forth thing. It's either you have gender dysphoria / gender identity disorder, or you do not. Those are the diagnoses that determine whether you are actually trans. Not identifying as queer, non-binary, AFAB, or any other LGBT, LMNOPQBS swamp thing shit that you think you can come up with. Okay? You want to identify like that? Fine. But it's not trans. It's not trans. Period. End of story. I lived most of my life as a biological male. Still am a biological male. I was 48 years old before I started my social transition. Taking on the presentation of a female presentation. Mannerisms, clothing, makeup, shaving and staying shaved. Unless I have to go for electrolysis to remove my facial hair. Staying out of women's places where it's not appropriate for me to be into. Like a women's showering facility. Right now, I don't belong in there. I haven't had bottom surgery yet. I don't fit in. I would scare the crap out of those girls and women. And that's wrong. It's wrong for me to shave in a women's spaces like that locker room or restroom. It instills fear. And the only reason I think people do that is because they want to cause fear and physical harm to other people. It's the only reason. What other reason is there? There is none. Because they're not trans. They're saying, quote unquote, I'm trans. So they get led into those spaces when it's not the truth. Because trans women and trans men that are really trans, and I identify more as transsexual because that's the only one that actually fits those of us who are actually really trans. Okay, we can't transition our sex. No, it's my sex is always still going to be male, but I can change the appearance of my sex. My mannerisms of sex. A whole lot less masculine and a whole lot more feminine. Okay. That's what it's about, being trans. And having this mental illness and disorder. There's nothing wrong with it being an illness and disorder. because there's something we can medically do about it to relieve it, get some relief from it, from the disorder, the dysphoria, alleviate some of a lot of the depression and anxiety. And when people say that you don't have to have gender identity disorder or gender dysphoria to be trans, run away from them quickly. They are lying to you, and they know they are lying to you. I care enough to tell you they're lying to you. Run away from them quickly. Please get in touch with somebody that has some sense, common sense, and that lives in some kind of reality. Not some kind of reality, just living in reality. And some things are fluid, some things are not. Some things can be kind of here, kind of there. You say thing. Because it varies. There's things that vary. Like bipolar depression. It's got ups and downs, highs and lows. That sucks when you're low. And it's holy crap. I'll go no quit, too legit to quit when you're on a high. Talk about having insomnia and exhaustion. Yahoo. Or so just so chronically depressed. It's like, I can't do a thing. It's like sometimes it feels like having to get up and go use the restroom is like, oh my god, I'm so depressed I have to use the restroom now. And stuff. So maybe not that, but other things. And knowing there's things that I need to do to get out of that space, and not having the energy or desire to want to do that. I also know the results of what happens if I do that, those things that'll help me get out of that. And sometimes I got to do it for a while to get out of that space and get into where my thinking and my actions and reactions are better. And it's okay to have a mental health therapist that actually does therapy. Not, okay, here you go. We got this antidepressant, anti-anxiety. Bang, there you go. First visit. And maybe some people need it the first visit. But we don't know if we don't ask if important questions aren't asked. And if it seems like people that are therapists, if it seems like they are probably more than likely going to need it, start them out on a low dose, please. So we don't want them over medicated, and start out with a low dose. We can find out if more is needed, extra strength is needed or not. Don't want them overdosed or underdosed. Finding the proper dosage, because it's not a perfect science, not even anywhere near this galaxy of close to being a perfect science. And that's even gotten better. It's gotten a lot better, I'll tell you that. It really has in certain areas, except for gender affirming medical care right straight out of the gate from day one. Okay. Person I know that puts out YouTube content. I know you know who I'm going to talk about. I'm going to say, I know you know who this person is, Buck Angel. Okay, if we need that stuff, get it. Take care of your mental health. Get a therapist that doesn't write off affirm. Yep, you are. Here's your meds. therapists that will have care come from the side of compassion and actually caring about what they're doing for and helping the person. Help them explore their gender identity and help make sure if it's that's something right for them. And I went to a therapist that was not a gender therapist for the first time about like gender dysphoria and being trans. And I am so thankful I did. I really am. She asks those questions with a caring, soft and caring heart. She made me look at truths a little bit deeper into them. Ones I already knew, ones that, okay, I can see that, where that's coming from. Yeah, okay. Maybe that one not so much. I know there may be some validity into it. Somebody that'll bring up things that I might not be thinking about or looking at. That will help me to get into a position that's good for me. And then I got a gender therapist too. I had 2 therapists for a while. I still do now. That first therapist I went to, she was retired and she was so sweet. She was a sweetheart. And we didn't agree on everything. Absolutely not. No. To tell you what, within those things that we didn't always agree on, there was things that we could agree on about around us, surrounding certain things. I was able to be helped looking into certain places in a certain different perspective than mine. And consider the things that are being said. Well, Kendra says it's safekeeping, not gatekeeping, and I believe that it is safekeeping because it's about the safety of the patient and trying to not do something that is not going to be needed or necessary. Because sometimes it can definitely point that way. Still doesn't always mean it's going to be that way. Until I can have a better perspective and a better look at it, it's I'm the one that I need to look at it. Sometimes I need help with those certain things. That I just never thought about it this that way. I'm not a genius. I know how it feels to be depressed. I know how it feels to be sky high happy. And I know what it's like to feel like a yo-yo when the ups and downs of that. It stinks. How does it stink? Yeah, children who medically transition, and I've heard this 100% of the time. When they start on hormone blockers and get ready to cross-sex hormones, their sex drive is zero. And they have no gratification from lovemaking. They were robbed of that because puberty blockers are, and doctors have even said this, a chemical castration. It destroys the reproductive system. Women have gotten vaginal atrophy over it. Women who transition to male have had vaginal atrophy over it at times. Men who transition to women have had testicular atrophy at times. transitioning from one to the other. There's side effects, okay, that need to be talked about with patients. Other than, okay, you're going to notice this and this is going to change. There's going to be new feelings on this and that. And we know what they are. Look into it. Look into me. We need to look into ourselves. And that's where the non-affirming gender therapist is so wonderful. Because they're not out to just affirm your depression. Okay, I'd like to say this, kid, and this is with all due respect, and I don't want to take personal. I'm not going to try to intentionally say something bad. It could be construed that way, but that I'm not saying this. I'm not saying it's bad. It's probably it's going to be something that's a good thing, actually, if it's used in the way it should be used when it comes to mental health therapy. Okay. Talk to a therapist. There's ways you can get help with get a therapist. Look at some of the colleges, into the psychologists, because sometimes they have students do therapy sessions. I go to one that I'm doing therapy sessions with now from a university. It's a local, but not local. And yeah, I told this person, just sometimes, there's something we're not. I told the person we're not going to align a lot, and it'll probably be mostly different when it comes to the way we think about trans people and the way we live our lives out in society today. And that is very true. We do have differences on those, strong differences on those. I still like the therapist, I really do. And now this is, press on it a bit with me. Help me research it, look into me and what's going on with me about those situations. Because that's what I need to find. I need to keep seeking those things. So it just as a defense of something in the future doesn't rear its ugly head and I'm going, come here, I want to choke you. You bilk. When I tell somebody to puke, I need to look in the mirror. And, yeah, life is too short. Life is too short. Please find a better way to help children. Let them explore their gender by wearing different clothes if that's what they want to do from time to time. Play with different toys from time to time if that's what they want to do. I haven't seen a trans person yet that doesn't have more than one side to them. Or multifaceted. Trans does not define who we are. It's part of who we are. And I can make better decisions, more informed decisions as an adult than a children can. So I got more life experience. All I have to do is show love, tolerance, and compassion. That's the best I can do. So I'm going to end it here. It's about 54 and a half minutes. Just about. Hey, that's cool. But anyway, we all need to get together. Be honest about things. It's give and take. We owe that to ourselves and we owe that to our children. Stay safe. Remember, I love you and have a great day. Bye-bye.